guys, welcome back to my channel. My name is Gifty and I'm a midwife. If this is the first time on this channel, then please do well to subscribe to the channel. On this channel I share things relating to pregnancy, birth, postnatal, baby, and things useful for that kind of special time in your life. In this video today I'm going to be discussing the top 3 pain reliefs during your labor and in which order you should be going with in most cases. So during your labor you may start off at home, and for the purpose of this video I'm going to say you are low risk, having your baby in a hospital on a delivery suite, and you've started your labor at home. So these are my top tips for the pain relief management when you get to hospital. Okay, so this is not when you're at home and what you can do. This is for when you get to the hospital, the top 3 pain relief that you will be more likely to be introduced to or to be told about, or you may already know about. So the number 1 is the gas and air, also known as the Entonox. This is the gas and air where you will breathe in through a long tube which is hooked against to what the gas and air supply is coming from. And when you get into hospital, by this point you will be having regular contractions, and you are having them lasting quite a while, at least 40 seconds to 60 seconds, and they'll probably be coming quite regularly as well. So maybe every 2-3 minutes you're getting a contraction that's lasting between 40 seconds to 60 seconds. The intensity will be quite high and you'll be feeling like you need something to help you to move along. So your first thing that I would recommend you go for will be the gas and air. Now make sure that you are informed how to use the gas and air, because it doesn't work if you don't use it the correct way. So what you want to do is to try and breathe it in really deep and then breathe out really slowly into the mouthpiece. So you don't put it in your mouth and then take it in and then pull away to blow out. You keep it in your mouth and you're going to blow into it. Take another deep breath of it and then breathe into it again. Now the best time to use it during your contraction is that as soon as you start to feel your contraction coming, so from maybe the lower back moving to the side underneath your bump and over to your belly, and the uterus getting really tight, is when you want to start taking it. So as soon as you start feeling it coming, so the surge building up and coming, you start taking your gas. Do not stop the gas until the contractions feel like it's dying away or is completely mellowed down and is gone, or at least is really, really low. Okay, so you take it from the beginning of the contraction. When you get to the peak of the contraction, you're going to feel like you want to throw it away. You don't want to have it anymore. You want to scream. No, don't do that. Don't take it out your mouth. Don't throw it away. All you have to do is to take even deeper breaths of it. So you take a much deeper suction and you breathe really slowly into it. Okay, so really control breathing is what you want to do when you're using the gas and air for it to be really effective. So that is the number 1 thing to use. The second thing that you can move on to, which is slightly stronger than the gas and air, but it's not as strong as our number, the highest one. So let's say the gas and air is your 3rd in line. This second one is your midpoint pain relief, which is called either pethidine or diamorphine. Is a different name depending on which hospital you're in. Now the benefit of having a opiate pain relief is that it works really well. It doesn't take away the pain completely, but it does sort of take the edge off. So you feel the contraction, the discomfort of the contraction, but it's sort of a bit distant and you're a bit distracted from it. So it does make you drowsy, and you will feel like sleeping. So if you are in a hospital using or in a birth center using the pool, once you've been given a diamorphine, or when you want to have a diamorphine, they will not allow you to be in the pool, just because you might feel really sleepy, really drowsy, and then they don't want you to be in the pool to fall asleep. So you will need to come out of your pool to have the diamorphine. It does also, however, cross through the placenta to the baby. So this medication is not given later on in your labor. So it's best to have it in your early stages of your labor. So let's say, for example, you go into hospital, you're examined, and then they say to you, you're about 4 centimeters or 5 centimeters, and then you've used the gas for a little while, and you just think the gas is just not doing it, and you need something a bit more stronger. Now, they will not give you this if you are towards the end of your dilatation. Let's say, for example, you're about 9 centimeters, or you're really close to, even if you're 8 centimeters, for example, and you're contracting really well, you're, progressing really fast as well, then they will not recommend having the pethidine. Because like I said, it crosses over to the placenta. It does make your baby also quite drowsy. And therefore, if given to you really later on in your labor, then your baby is going to come out really, drowsy as well. And this is really going to affect your breastfeeding or feeding of the baby within the first 1 hour. The pethidine, once given, it takes about 4 hours for it to really take, for it to completely wear off your system. It starts to work pretty quickly, and you start to feel drowsy quite quickly as well. And like I said, it's much stronger than the gas and air, and you don't need to hold on to any tubing or anything. This is done through an intramuscular injection, either in your thigh or your buttocks, and this will help with contractions and this, the pain that you're getting through your contraction. And then the number one pain relief, or shall we say the top pain relief here, will be your epidural. Now, epidural, which I personally refer to as the Rolls Royce of pain relief, okay? Once it's done, in most cases, majority of cases, there's a really small percentage that it will not work the first time, and you may have to get it redone again, or you will have to, get it moved a little and things like that. But in most cases, it works really well. It takes away all the pain, okay? When it's working well, you'll be having regular contractions, and this will be seen on a monitoring device called a CTG, which you have it continuously once you've been given an epidural, because we need to know how well your body's coping, your baby's coping with that, and how well your contractions are, going, and, we can see what's happening in your body, because you're not going to be able to vocalize how your contractions are, how strong they are or anything like that. So we would need to have you on a monitor, which will constantly regulate and check your baby's heart rate, your baby's vital signs and things like that. And also it's going to check that your contractions are still progressing and they come in regularly and often, and they're doing what they're supposed to do. So the epidural is the real, the bee's knees of pain relief. So, for mums who are already, thinking, oh my goodness, the pethidine did not work, or the diamorphine didn't work, or it's worked, but now I really need something even stronger, then of course your epidural will be your next best thing. Okay. Also, some women will go straight and skip the pain relief, such as the gas and air, and also the pethidine or the opiates, and they'll go straight to the epidural. So your top 3 are, like I said, number 3 is the gas and air, number 2 is the opiate pethidine injection, and your number 1 best pain relief during your labor is your epidural. Okay, but remember, all of these they'll make sure that you are suitable for them, and it's okay for you to have. You'll be monitored, you'll be in the right hands, and these are the things that I would say are the top 3 best pain relief during your labor. And I think also it's most likely you will go in that order. You start off really slowly and build your way up. So you start with your gas and air, and then you go into your opiate, and then you go into your epidural. Okay, I hope this information was useful for you. Please like the video if you found it really useful, and also share the video with anyone that you feel will benefit from the information in this video as well. Thank you so much for watching. Please subscribe, and I'll see you in my next video. Take care. Bye-bye.